this is Sarah Kite with UT Extension in McMinn County, and I hope you've enjoyed our coping corner that we did last month in June. This is July. Hope life is going smoother and you're balancing things out. You're managing your stress. You're coping with all the curveballs that are being thrown your way. You're doing well. Your family's doing well. And July, we're going to focus on connections. Dr. Conrad and I have talked about connections are so important to get through when you're trying to cope with life. We all need connections. Our kids, us. We all need connections. So I'm joined today. You can see I've got two guests today. Dr. Katie Conrad from UT Extension is here again today, and another very special guest that's joining us today. And I'll let you introduce her, Mr. Conrad.
Thank you. Yes, so this is, we're fortunate to be joined by Jennifer Drake Croft, who is the Director for Child Wellbeing from the Tennessee Commission on Children and Youth. They are a wonderful resource that does anything related to child advocacy across the state of Tennessee, and are integral really in bringing all of the awareness and education and support around ACEs awareness, so adverse childhood experiences and how that impacts later life health and social outcomes. And so we brought Jenn in hopes that she would share her expertise and a little bit more about the TCCY and how COVID might be potentially intensifying ACEs. So I would first ask Jenn, if you wouldn't mind just telling us a little bit about you and your role at the TCCY and what the TCCY does for Tennesseans.
Absolutely. Thank you both for having me. So at TCCY, our mission is to lead systems improvement for all children and families through data-driven advocacy, education, and collaboration. Our vision is that we strive to become the premier leader in children and youth systems improvement through innovation or through innovative and transformative approaches and practices. So through that, my specific role at Tennessee Commission on Children and Youth is to contribute to the systems change and the systems improvement by helping lots of different professionals and communities from many different sectors understand child development, understand the impact of ACEs and toxic stress on child development and lifelong outcomes, and also recognize the importance of community response in building resilience and tipping a child's resilience scale towards positive outcomes. So I'm super excited to be able to do that work on a daily basis and to work with all kinds of passionate people across the state who really apply this science from everything to the way in which they police, the way in which they teach or practice medicine, to the way in which they parent, right, or live in community with each other.
That's good. And I appreciate all that you do. Many years ago, I was trained by Jenn for ACEs, and I do the ACEs training here in McMinn County. All of our schools and childcare, some of the churches have been trained on ACEs. And we've talked about ACEs before, which stand for adverse childhood experiences. So I want to just kind of ask you a few questions. So as we go through this pandemic and other life, things, traumas and stressors that we have that, are impacting us, specifically going through our pandemic though, think about like in your role, in your position, in the walks of life that you are in professionally, what is it that you're seeing so far or hearing about regarding how ACEs are impacted by this pandemic?
Absolutely. So we know that when families and communities are stressed, that it increases the prevalence of adverse childhood experiences and toxic stress. And that makes sense, right? So it makes sense that when you are maybe compromised financially as a parent, or if you are really struggling with lots of different challenges and demands, that it's going to make parenting, which is already difficult, that much harder. And so this pandemic, for lots of people, we're seeing not only a significant change to the way that we live, work, and play, right? Where we are unable to be socially or at least physically connected to other people, where we are isolated, where our children are not in school and we are juggling, you know, helping them throughout the day and teaching them and engaging with them and co-regulating with them, right? Where if they're upset, that we're helping them calm down over and over and over again, and major disruption to their routine, that we have that. But in addition to that, we are also trying to juggle our respective jobs or other responsibilities that we had prior to COVID, or that perhaps we've lost our jobs, right? That our positions have been eliminated or we've been furloughed, which adds a whole level of financial stress, right? And a lot of our communities are feeling these reverberated effects as well, right? Communities are concerned about their local budgets. They're concerned about making ends meet. We're seeing childcare facilities close down. And so there are lots and lots of stressors that are present through COVID in a way now that they weren't present before. And yet, here's what we know about adverse childhood experiences. So as Sarah was saying, there is an ACEs study that was done 20 years ago. There have been many, many other studies done since then, but the original study was done with 17,000 people, and it was in partnership with Kaiser Permanente, which is both a provider of healthcare services and is a healthcare insurer, and the Centers for Disease Control and Prevention. And so this study really looked at the relationship between childhood adversity, and these were adults that were looking back at their childhoods and reporting, and the rates of disease, disability, social problems, and early death in adulthood. So they looked at 10 different types of adversity. They looked at 5 different types of abuse, so physical abuse, sexual abuse, emotional abuse, physical neglect, and emotional neglect. And then they also looked at 5 different types of household dysfunction, which included having your parents divorce, having a parent who abused substances, having an incarcerated parent, having a parent with a mental illness, or having your domestic violence in your household. And so for each of those events, you said that you had experienced it or you had not. And at the end of the day, you had an ACE score between 0 and 10. Either you'd experienced 0 of those things or you experienced all 10 of those things. What they found is that there was a graded dose response between your ACE score and disease, disabilities, social problems later in life. And so the tipping point really was 4 or more ACEs. So it didn't matter which ones they were, any combination of those 10. And you started to see really increased rates of mental health issues, substance abuse issues, and 7 out of 10 of our leading diseases, stroke and heart disease and diabetes, right? And so what we learned from that study and what's been replicated in the last 20 years in other states and communities is that at a population level, we see that when people have higher adversity, that has a relationship with the rates of disease and social problems that we see, right? The other thing that we learned from that study and that we've seen here in Tennessee when we've looked at our own ACEs is that ACEs are extremely common. So 60% of Tennesseans as of 2017 have an ACE score of 1 or more, and 1 in 4 people have an ACE score of 3 or more. So these are incredibly common. Now we have COVID, right? That has emerged and is giving us an extra layer of stress, strain, and disruption. The science shows us that there is a strong relationship with financial instability, with parental and community stress, and the incidence of adverse childhood experiences. So we can expect that based on the literature that's been done previously, that this pandemic will be increasing something that's already incredibly prevalent in our population, and that we will really have to use our ingenuity as a community to support families and support children to buffer the experiences of stress and to help them heal after this pandemic, either while it's going on or after it's over.
Yeah, we all need each other. Our kids need adults that are safe, stable, and nurturing. We all need each other. Going back to school for some might be a huge blessing. We've got grandparents raising grandkids that are stressed out, parents, like you were saying, jobs here, jobs changing. We all need each other. And that's where our Connection Quarter series has come from, that, as I deal with my stressors, I might have these already going on before COVID, and this pandemic intensified it. I still need to deal with it. I still need to have that strong connection with someone who I can go to help me with those things and help me cope through it. But those connections really are a big, strong predictor of how to get through the tough times, whatever those tough times are. So I 100% agree with all that. That was so, I guess, enlightening. But I mean, it's so true. We just need to realize we know these things as common sense, but the impact it puts on us and our kids, it's so very important to realize and then do something about it. And having good, healthy connections is, a very big key to all that.
Yeah, and Sarah, I want to piggyback on that because I never like to talk about ACEs and toxic stress without talking about those things that can mitigate those stressors or make them more tolerable. And it's exactly what you're saying, right? It is connections. It is safe, stable, nurturing relationships and environments. So when we support families to have the bandwidth and the capacity to provide those safe, stable, nurturing relationships, we take this stressor from being toxic to tolerable. Like, children can tolerate a lot if they have adults in their corner that support them and make them feel safe and make them feel connected to. But guess what? If we as a community are not supporting those adults, they're not going to have the bandwidth to engage in those demands. So it's incumbent upon all of us to support families so that they are able to be nurturing. It's kind of like if you think about those Russian nesting dolls, where you've got a doll within a doll within a doll. The community and the ways in which we support families directly impacts their ability to support and provide relationship to their children.
Yeah, and I really like that you bring in the role of the community. In former videos, you really talked about, how it takes a village, in a sense, for child development. In the past, and this is before we really were talking centuries ago, or rather a century ago, when social science research was new and the psychological field, and they were saying it's all genetics. And then later on, they came around and said, actually, it has to do with your social experiences. It's not genetics. And they had this long debate going back and forth. And now we're recognizing that, wow, it's an interplay between both. Our genetics can bring out certain genes and predispositions for certain diseases, disorders, disabilities, and so on. And so just you shared these slides, which I would love for you to expound upon. But one thing I really love about this one graphic is it really shows the role of the community in being kind of the soil that feeds into what might perpetuate ACEs. And so I was hoping you could kind of expand a little bit on that, because I think we often can get kind of confused of how much our community and our things that are not directly touching us can actually touch us in other ways.
Absolutely. So this pair of ACEs was developed by the Building Community Resilience Initiative out of George Washington University, and it has been incredibly helpful for people not only in our state, but people nationwide, in helping folks understand the connection between adverse childhood experiences, those 10 ACEs that I talked about previously, and adverse community environments. And so what we know is that adverse community environments, things like poverty, discrimination, lack of economic opportunity and social capital, poor housing, violence, those sorts of things, those affect the roots of the tree. And then what you see, and they're often below ground, right? Like we often either don't see those things that are going on, or we don't understand how they relate to some of the issues that we struggle with as a community and as a state. And so thinking about a tree and thinking about the soil quality and the conditions and the environment of a tree, it's going to affect the fruit that that tree produces, or the foliage, or how well it grows, right? And so what we know is that when we have these adverse community conditions, they really provide the foundation, the soil, the nutrients that are going to lead to these negative outcomes, right? And unless we want to, or if we want to, really address things like the opioid epidemic, or heart disease in our state, or violence in our state, right? If we aim or aspire to decrease those issues, then we have to attend to the community conditions that are perpetuating those outcomes. And so when we think about the COVID pandemic, you can see how all of this is exacerbating, or has the potential to exacerbate, adverse community environments. So we're seeing increases in poverty. We're seeing discrimination as it relates to disproportionate, what am I trying to say? Sorry, disparity rather, with COVID contraction, right? And medical response to COVID. So we're seeing that Black and Brown communities are more frequently exposed because of the types of employment that they have, or the types of community that they live in, and they have decreased access to healthcare, right? And so there are inequities that always existed, but they are being exacerbated, and a clear light is being shown on them as a result of COVID, right? We also see this community disruption that's here, as well as we're seeing a decreased economic mobility, and we might, as a result of these things, see decreased housing, safe, stable housing and investment in those resources that would help promote well-being and resilience, right? And so some of these things we're seeing today, some of these things are going to be repercussions in the future. And as I said before, because of those conditions that are being laid in our communities, we will in turn see an increase in the prevalence of ACEs in our community.
So, do you have any specifics based on, recent research or anything that you've seen kind of come through Tennessee specific data on where some of these ACEs might be most prevalent?
Yeah, absolutely. So a couple of things. The first thing is that we are so early in this that we don't have all the data that we wish we did. And it will emerge in the coming years, right? We will begin to appreciate the full impact of this pandemic on our communities, on our children. The other thing, though, is that some of the data that we're seeing is already troubling, and lets us know that that a lot of the supports that are in place have been removed for children and families. So the first thing that I'll talk about is we've seen rates of abuse and neglect significantly reporting rates decline. And most people at first blush would say, well, that's a good thing, right? We want to see that abuse rates, and neglect rates decline. But the reality is that so many healthcare professionals and educators and after school, staff and other adults in the community are the ones that report child abuse and neglect, right? So without eyeballs being on these kids, without them having access to these safe, stable, nurturing relationships and environments, abuse and neglect that may be going on in the home is not being detected, right? And so we're not able to respond as quickly. Also, we are seeing a removal of all of these community supports. And we know that a lot of the issues, you know, joblessness or unemployment, decreased or, well, increased financial strain, all of those things are proxies for increased stress and an increase in abuse and neglect, unfortunately. So a lot of the research that we have shows us that when families are less stressed and when they have more when they have greater access to resources, including just strictly financial resources, that abuse and neglect rates go down considerably, that there's an inverse relationship. So it's going to hold true that that relationship's still going to exist as families have decreased access to those support services and real tangible things like money, right? That we will see rates of abuse and neglect go up, and we will have fewer adults interacting with children or interacting with them in with less frequency. That would allow for intervention to happen in a more timely manner, if that makes sense.
Yeah, and that was something that I had noticed too, because I had expected that the child abuse and neglect rates would go up during this time. And then when I saw that the rates had actually gone down, I was like, there's something else there. And it's like, ding, 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 reporting. We don't have educators or teachers on the front lines who work with students or, you know, those in mental health or other sort of social work type positions are not there to notice these and report. So that's a startling finding.
And Katie, you asked, I realized I didn't answer part of your question, which communities were being affected the most.
Yeah.
And I will say that we already see hotspots as it relates to COVID rates. And those hotspots, even in a metropolitan area like Nashville, tend to be in those areas where you have populations of people who are already disenfranchised. So what we are seeing is that, again, in Black and Brown communities, even in Nashville, that's where we're seeing the hotspots for COVID rates, which again is an indicator for so many other things, right? That these are families that don't get to physically isolate, like they still have to go into work, that they don't have the same level of protections or healthcare or those kinds of things. And so we also know that while ACEs are common among all socioeconomic demographics, races, ethnicities, that there are disproportionate levels of ACEs for Black and Brown children and impoverished communities, right? And so we will see that show up, yeah, even if we don't have all the numbers right now.
So taking all this, I mean, there's a lot of work to be done, clearly. What is TCCY's, Tennessee Commission Children and Youth, what is your role and, you know, next steps in handling COVID-related challenges and intensifying ACEs for Tennessee?
Absolutely. We often like to show this other pair of ACEs, so to speak, to really orient people toward the sort of innovative solutions that we as a community have to employ in order to promote all prosperity for every one of us, right? So we know that we're all connected, and that our tax dollars, our crime rates, our quality of life are going to be impacted, even if we ourselves and even those in our family have an ACE score of 0, right? That our quality of life will be impacted by those children who have experienced adversity, trauma, and toxic stress. And so when we think about what TCCY is really promoting, we are both promoting the addressing adverse community environments, as well as specifically tackling and mitigating adverse childhood experiences. So I mentioned before that we have a focus on systems change, right? That is our big effort at TCCY. And it's because we know that when we change systems, when we change attitudes, culture, philosophy, policies and funding, programs and professional practice, right? When we change those things, they have an immense ripple effect on the well-being of children. So what you see here is that we are helping people understand that things like lead prevention services, for example, or public housing, or affordable transit, or childcare supports, right? We're dealing with this very startling and challenging statistic that half of the childcare centers may close as a result of COVID-19. And we were already dealing with a shortage in our state, right? And that is one of the biggest challenges that we face in terms of promoting child and family well-being, right? So we are, as the Commission on Children and Youth, are helping the community, helping professions understand how supporting resilient communities, or creating healthy communities where children have the opportunity to flourish and thrive, is going to decrease ACEs, increase positive childhood experiences, and therefore lead to a better society for all of us, a society that's less sick, a society that's dealing with less crime, and a society that where we can better use our tax dollars and experience collective prosperity. So that's one thing that we are focusing on at the Commission on Children and Youth. But other things that we are focusing on are what you see above ground in this graphic, right? We are focusing on those kinds of systems and supports that would early mitigate or prevent ACEs if we have not been able to change the adverse community environments, right? So things like evidence-based, high quality home visiting in our state, pregnant and new parents. Things like high quality, affordable childcare, and ensuring that educators who work for these institutions understand early child development and understand trauma-informed practices. We're supporting trauma-informed juvenile justice systems and trauma-informed policing, trauma-informed schools, et cetera, because we know that when all of these systems begin to understand poor outcomes as a means of communication about trauma instead of you're a bad person, right? Then we start to actually get to the root of what's driving the issue, and we can meaningfully change it, right? The reason that we have struggled as a state for so long is because we didn't understand, we didn't connect these sciences. And people thought, oh, if you're abusing substances, you're making poor choices, you're a bad person. Now we know that most people who are abusing substances were individuals who have experienced a lifetime of trauma, and this is their means of coping, right? And so we can not only better treat those individuals, but we can prevent substance abuse in the next generation. So, you know, that's essentially what TCCY is trying to do. If you think about other kind of public health efforts, things like smoking cessation, changing the culture of smoking, it meant empowering everybody in the community to understand the dangers of smoking and to understand what can create good health. And that meant that this didn't just live with doctors or insurance companies. It meant that people that were tasked in responding to this were the media, schools, businesses, government, right? All of these various sectors were responsible for taking their part in changing the culture of smoking. And over time, that's what happened. And now you can go to anybody out on the street and say, what are 2 diseases associated with smoking? And they can tell you, right? Now we have to do that with adverse childhood experiences, because ACEs create more poor health outcomes than smoking, and also increase the incidence of smoking itself, as well as other kinds of issues, right? And yet, if we walked out and talked to community members about ACEs and we said, name 2 diseases associated with ACEs, they could not tell you. Many people who are not in the field of psychology or social work or education or counseling have never even heard of that term. So we have to make this common knowledge among everybody in Tennessee, and also help them understand the ways in which their community and them coming together is going to be the very thing that is the healing or the antidote for childhood trauma and stress. And so that's kind of our goal at TCCY, and we do that through a myriad of things. One of them includes public awareness, training, etc. But also just sitting at those tables with those leaders and those professionals to think about how we design systems to support children and families.
I do enjoy the partnership with you. And I think about, you know, if someone's sitting there watching this presentation and reading the slides, you know, they might be stuck in this toxic space, this toxic environment. They have connections that are also unhealthy, and they're also in the same toxic situation. And, you know, maybe it's time to look back at that slide and think about, of that tree that I want to flourish in, you know, what community resource do I need to connect with to get me out of this toxic situation? So your connections that you are currently in might not be helping. So try to look for those resources. And that's part of building resiliency within self, within family, is to be able to connect with that environment that'll help you and then be able to bounce back out of it. So we might have time to quarantine and reflect and self-isolate. You know, now's a great time to find that community resource that you need, that your family needs, that your kids need, or multiple connections that you need within the community to get out of this toxic situation you're in, to then bounce back and then, you know, flourish and be healthy. And one thing that I love that we've done with these videos is have a take-home strategy, have a take-home activity, something today that you can do to help you out of this situation. Help you out of this situation. And Dr. Conrad has a great activity, a great strategy that you can apply today that'll help you with your connections within your environments that you live. But having that healthy, stable, nurturing relationship is all that you need. You need that. You need to get out of the toxic relationship, the toxic environment that's just holding you down. That's, you know, those roots that aren't healthy, but find that new connection that'll help you to flourish. So Dr. Conrad, if you want to share some great activities that families can use, that individuals can use, I'm ready to end on a positive note, because we've learned a bunch of facts. And one thing I've learned in ACE is that what's fact is not fate. So you have a bunch of facts. You might be like, oh no, now what do I do with my life? Well, you know, you can flourish no matter what's going on. You can still flourish. You just need some tools, some resources, some good connections, and it can happen. So take it away.
Katie, actually, before you do that, can I just say, you know, I talk a lot about this stuff and a lot about this data, but I'm also a parent, as are you two, right? And if you were a parent watching this, I do not want you to feel overwhelmed or feel like you are hurting your children or hurting their chances of their future. We are all dealing with unprecedented stress and demand right now. And the best thing that you can do for yourself and your child is to just connect, right? It's as simple as that. That is the very thing. It's as simple as laughing together, snuggling together, talking together, tickling, right? Reading a book. That's the very thing that is going to protect them from the stress of this experience. But also it means really giving yourself a break and a lot of grace. The more stress and strain you put on yourself, the more that trickles out and comes out sideways in your relationships. And so I know that Katie and Sarah feel the same way. We are not able to parent at the same level that we were pre-COVID. And so I used to try to limit my kids' screen time, and I still do within reason. but I also say, it is better for us all to be regulated, connected, healthy, for me to sit down with my child and watch a little show and giggle with her, right? That is the very healing thing. And so please don't feel this incredible pressure to be the perfect teacher, the perfect parent, the perfect employee during this time. It's all about grace. And the more grace you can give yourself, the more connected you can be with your kids, and the more grace you can give them. So I just want to bring that down to a really real level, after I showed all those graphics and talked about all those statistics, because we have to do the best.
Yeah, thank you.
Yeah, thank you. And that's actually a really great segue into what I was going to suggest. And in our Connection Corner series and finding strategies and ways to connect better with one another. So I came across this resource that we'll drop in the link at the end. But if you, this is something for, if you're an educator, you would find these are all social emotional learning activities and resources. But there's also some for families. And what really caught my eye was this one, 34 conversation starters for your family. And so these are things that you can have, say you're driving in the car with your children and you're going wherever you're going, and not that you're going very far these days. But they're just ways for you to connect more and have kind of meaningful and or silly conversations about things and get creative with what you're talking about. So, you could ask things, what would you do if you could fly for a day? If you were a great inventor, what would you invent? If you had $1,000, what would you do with it? So there are, 24 or so questions that you can, pick one, cut them out, put them in a hat, put them in a bag, and then, you and your child pick one before having dinner one night, and then you talk about it at the dinner table. Isn't that something similar to what you were doing, Sarah? You had a bag of conversation starters.
Yeah, and I brought it with me for our session, but I feel like my kids have come in here, and my 7-year-old likes to read, so I think he might have taken it to share with his brother, which is good. But we do that at dinner time. Sometimes at the end of the day, you sit down, you're just like, oh, let me tell you about all the things of my day, listen to what I heard in the news, listen to what I saw on Facebook. And then dinner table becomes like a rant of blah during dinner. And who wants to sit down to that? Your kids are just like, ugh. So we do that at mealtime, and we pull them out, and, anyone wants to read it. And the funny one was about, like, if you designed your own birthday cake, what would it look like? I love strawberries. Mine's strawberry filling, strawberry icing, strawberries on top, And then my 5-year-old, he wants a cake with cupcake towers and then like candy bars shooting from it. And I was like, we've never had that. I've never seen it on the TV. I was like, where did you come up with that design? He's like, well, I can only pick one dessert, and I love cake. I love cupcakes. I love candy bars. And you kind of learn their imagination. You learn where their minds are going. You learn more about your kids. I didn't know he loved all three equally, So yeah, they're really good fun bonding. Some are serious. If a family member's passed away, it talks about, who do you miss the most that's not here anymore, why? So some are fun, some are serious, but you get to that heart of that child. They get to your heart as a parent or a grandparent, whoever's with them. And it's just a good bonding tool. And sometimes they'll just ask you random questions. They want to make up their own. You're like, uh-oh, here we go. But they're just fun. We get books and stuff that they read, and they'll pull something from there and be like, okay, if you could create a car, would it have a pool inside? Like Randy, we just read that book about Randy Riley. So I love them. You can make up your own, but if you're really not in the right headspace to think of questions, that is a really good tool. Just print them, cut them off, and, have fun with them.
Right. There are several other resources too on that sheet. Another one was a Dear Abby. If you all remember, well, some of us may not, but in the newspaper back in the day, they had the Dear Abby, and then you would state your problem, and then she'd write back in the paper and answer your question. It's usually something personal. And so they had something that's kind of the kids edition and about school related problems and stuff. And you know, you can get kids together and give them a scenario and ask them some questions. You know, have you been in that situation before? What did you do? How did you handle it? And you know, if you were to face this dilemma again, how would you strategize so it wouldn't be so hard? And you go through these different questions, and we have the questions too that I'll share for you. But it's just another way to get thinking about not only how you would handle that, but how you could work with others. And Jen said the word earlier, co-regulate, how you can help others feel the way that they want to feel, which will help you in turn feel the way that you want to feel. Co-regulation is a key to helping to manage conflict and, you know, come back from adversity. So, Sarah, do you have anything else, or Jen, do you have anything else you want to add?
I would definitely suggest using that tool. And if there's, you know, a classroom teacher that's coming back in the fall and you're like, I don't know what's going to happen, my kids are not going to know what's going to happen, everyone's going to kind of be on edge and be anxious, and kind of, how do you teach to an anxious kid who's just scared or super excited to be back with friends, or the emotions can be super high in either direction. But having those as like your icebreaker, you know, open question, you can talk about it, you can journal it, you can draw a picture depending on their age, but that's a good way for a kid to feel bonded to teacher a little bit quicker. And as this pandemic's going on, or it's coming back, or it's going away, or it's flatlining, whatever is going on in your county, you know, it's a good way to kind of bond and know that, like, this teacher actually cares, not just about the subject matter, but about how I'm feeling, and I can openly express it to them. And that'll help your whole classroom mood just kind of mellow out. Or all of you give, you know, virtual high fives. I don't know how it's going to look, but, you know, you want to, as a teacher, you know, use these in your tool bag to help these students. And, you know, we can also help at home with our kids, but it's just a great way to just feel connected to all the people that are in our community that can help us through stuff when, you know, stuff hits us and it's just kind of weighing on us, to then get through it and it become that positive stressor in our life, that, or tolerable stressor that can help us grow stronger when the next whatever hits us, you know, in 10 years from now, or 20 or 5 years, you know. But, you know, it's a great tool. So I definitely would recommend everyone look at all those resources and pick and choose what might help you today or next week, and really utilize it, because sometimes we can't think straight. We need a tool like that to do our thinking for us, to help us in our connections and our bonds. So thank you for sharing that. It's really good.
Mm-hmm.
All right. Well, appreciate your time, Jen. You are a super fabulous lady. We love our ACEs work that we do with you and all the work that you guys are doing. Hope everyone has a great day today. Our first Connection Corner. We love connecting with you all. Share this with others. You can like it. You can comment. We'll have the link for the resources for you. Just enjoy connections that are healthy, make strong bonds, and just have a fabulous Wednesday. And we'll see you next Wednesday for our Connection Corner. Have a great day.